Hello guys, this is Dr. Azama. Today we are going to talk about anatomical terminology. So let's get started. Anatomy and physiology. Anatomy, the study of structures and relationship among structures like bone connected with each other, muscles connecting to the bones. We will go in deep. Physiology, how body works, how body structure functions. That study is called physiology. Anatomical position. First of all, we have to consider a standard position to define the things of an human body. What is anatomical position? Anatomical position is first your body should be erect with feet parallel and arms hanging at the sides, and your palm facing should be forward. Other positions of the body, there are many other positions of the body we will discuss. First one is the anterior and posterior. Anterior, just like this one, the body is facing forward, and the posterior, just like this one, the body is facing posteriorly, backward. Anteriorly, to be situated near or toward the front of the body. Posterior, this is the to situated toward the back of the body. Second one is the superior or inferior, and cranial and caudal. Superior means that upmost position, upper part, which is like means to situated toward the upper part of or head of the body, position above another organ or structure. Second is the inferior, situated lower part of the body or position below another organ or structure. Cranial refer to the head end, and caudal refer to the tail end. Second, now third one is the medial and lateral division. First, this is the midline of the body. If we go away from the midline, then we will call it as the lateral, and if we go toward the midline, things will be called as the medial. Medial, to be closer to the midline of body or a structure, being internal as opposed to the external. Lateral, to be further away, like this one, further away in the direction of either side from the midline of the body. Here we can see the anterior toward the front and posterior toward the back. This is the midline, lateral away from the midline, medial toward the midline. Fourth one is the proximal and distal. Means that proximal, near the trunk, nearest to the trunk, and distal, away from the trunk, toward or nearest the trunk or the point of origin of a part, like this one. Here the limb is arising from here. So at the medial or at the origin point, we will call it as the proximal, and the most away point we will call it as the distal point. Distal, away from the farthest from the trunk or a point of origin of a part. Now we will define this terminology on the humans. First, this is the midline structure. Midline structure, if we go toward the midline, we will call it as the medial terminology. From the away from the midline, lateral terminology. This is the proximal. If we go away from origin, we will call it as the distal. Superior, above portion, means the superior most portion. Inferior means that lowermost portion. Here, this is the anterior ventral division, means this side is the anterior ventral, and backward portion is called the posterior or dorsal portion. Fifth one is the unilateral or bilateral. Unilateral means it is present on one side, whereas the bilateral present on the both sides. If I can give an example of unilateral, then what should it be? Most of the things are in our body is bilateral. Like we have bilateral limbs, bilateral eyes, bilateral ears, bilateral legs. Superficial or in superficial and intermediate and deep terminology. Superficial means that it lies outer surface body. Superficial means that it lies on the outer surface or outermost surface layer. Superficial near the outer surface of the body. For example, skin is superficial to the muscular layer. Intermediate between the superficial and deep layer. The navel is intermediate to or intermediate between the left arm and the contralateral right leg. Navel is a region which is intermediate to the left arm and contralateral right leg, or vice versa. Deep, further away from the surface of the body. Like muscular layer is deep to the skin, but superficial to the intestine in our abdomen. Here we can define three terminology on the basis of muscles. First one, this is the trapezius muscle. You can see that it is superficial to the splenius capitis muscle, and again we can see that trapezius is the, if I am giving an example, then I will give it like this. Trapezius lies in the superficial layer, splenius intermediate layer, then again deep to the splenius we have other muscles like rectus capitis and other many. Body plans. They are based on four imaginary planes that pass through the body in the anatomical position. They are sagittal. First one is the sagittal. Second, mid-sagittal median plane. Third, frontal or coronal plane. Fourth one is the transverse or cross section. We will define these. First, sagittal plane divides body into right and left parts, like this one. Sagittal. This is if sagittal is crossing from the midline, then we will call it as mid-sagittal, because it will divide into two equal halves, left and right. Sagittal can be anywhere, like it can arise from this point to go and that point. It can, if it is passing from the midline, then we will say it is the mid-sagittal or median plane. Third one is the frontal or coronal. We can see that it divides body into anterior region and posterior region. Means that this plane is dividing anterior region and posterior region. Fourth one is the transverse plane or cross section or horizontal section. It divides the upper part and lower part. Now we will we will discuss the terms of movement. First one is the flexion and extension. Flexion, we can say that it brings the structure toward the midline, and extension it push the structure away from the midline. There is an increase in angle in flexion, and there is decrease in angle in extension, like this one. We can flex the arm by contractile of property of the biceps. We can extend the arm by the contractile property of the triceps. This one, extended wrist, it is going upward, extended wrist, and flex wrist is going downward. We have other examples like this one. If here the example of the extension and flexion movement. Here the example of extension and flexion of the fingers. Here is the flexion and extension of the ankle joint. Extension means the plantar flexion or dorsiflexion. We can see that here the arms flexion and extension. Here's the flexion and extension of the leg and the flexion and extension of the wrist joint. So now we will discuss about the abduction and adduction. Abduction means that it is moving away from the body part. It's moving away from the midline structures. Adduction, it is the structure is moving toward the midline structures, like this one. Uh, these are the midline structures or median line or midline. Now the arm is moving from away from the midline structure, then we will call it as the abduction. If that arm is going toward the midline, then we will call it as the adduction of the arm. Supination and pronation. Supination means that rotating the hand or forearm laterally, like this one. Like you are holding a soup. You can imagine that you are holding a soup. What will be your position of your arm? That will be supination. And pronation, rotating the hand or forearm medially, like this one. You are pouring this soup. What will be your uh, position of your arm? Imagine it. Plantar flexion and or dorsiflexion, we will differentiate between two. Plantar flexion, the point toes put downward, like this one. This is the center. We will, if we flex toward the downward position, we will call it as the plantar flexion. If we are moving upward, then we will call it as the dorsiflexion. Point toes upward. You can remember these terms. Imagine you are standing on a tiptoes. That is plantar flexion. Imagine your foot of the gas pedal. You will be imagine as dorsiflexion. Fifth one is the inversion and eversion. Inversion, movement of solely of foot inwards, like this one. If you are rising this portion upward, then this is inversion. If you are rising this portion upward, then this is eversion. Eversion, movement of sole of the foot outward. Sixth one is the medial or lateral, medial internal rotation and lateral external rotation. Medial rotation, anterior surface move toward the midline, like this one. This is the medial rotation. This is moving toward the midline structures. And lateral rotation is the anterior surface move away from the midline, like this one. Going there. This is the lateral rotation. This is the medial rotation. Because we are at the knee joint. Not, this is at the knee joint. If you lateral rotate, the knee will be displaced as away from the midline structures. So this is done. Now seventh one is the protection and retraction. Protraction means that moving forward on a plane parallel to ground. Means that if we imagine a scapula is moving forwardly, like this one, this is the normal position, it is going forwardly, then we will call as the protraction. Punch means that if you are punching something, you can imagine your movement of scapula going forward. Retraction is the moving backward on a plane parallel to ground. Start a lawn mower. Imagine you're starting a lawn mower, then you will realize that your scapula is going backward or moving backward, then this is the retraction. In both cases, protraction we will call it again as abduction, means that is moving away from the midline, and retraction we will call the adduction because it is moving toward the midline. Now, eighth one is the circumduction. Circumduction, Latin meaning it's around your. It's a combination of flexion, extension, abduction, adduction. Means that it's the combination of four types of movement: flexion, extension, abduction, and adduction. Like you're moving your leg in a circle. Imagine this is circumduction, or imagine your trunk is moving in a circular way. This is the circumduction. I hope you like the video. I hope you will understand this terminology easily. Okay, thank you very much.